had a question on mental health as well.
Yes, thank you, Chair. And to build really upon Barbara's previous question around mental health and the backlog, one of the things that is very clear during this crisis is the level of anxiety, the impact of mental health on so many people in a way that they probably never have experienced before. So there's an impact of that, but also with those people who have got elective surgeries and things that are being delayed that might be in pain, for example, that's also going to affect their mental health. And I just wondered whether we should be moving forward, looking at, say, every time somebody has a physical health checkup or sees their GP, there should be by standard a mental health checkup with that and questions asked to patients, everyone who's seen, around issues such as loneliness or anxiety levels, so that we can get a much better view of what's happening in people's minds and the mental health issues that are happening, so we can provide greater support, but also identify those who are going to be in need of that. And I just wondered, perhaps Chris Hobson, if you've got a view on that, please.
Yeah, well, certainly, I think one of the things that I've already said is really worrying our chief execs is the fact that we are expecting to see, and in fact, we're already starting to see significant increases in mental health demand. And what's very clear is, and there's two obvious sets of people who are likely to need greater mental health support. We've talked about, if you look at the past evidence in terms of when economic impact has hit, what you've seen is that there is a direct mental health consequence. So you can see there will be people who, from the economic consequences of lockdown, from actually the social consequences in terms of people who've not been able to, for example, go about their ordinary lives and are now cooped up in quite confined spaces. There are also clearly some people who, and one hears some really quite difficult stories of people who've been involved in loss of life, where in terms of relatives. So you can see there's a group of people there who will need extra mental health support. We also know that there are some really big issues in terms of our staff. If you look at what's been happening in terms of the real pressure and intensity there. And so, I mean, I was going to actually do a Jennifer Standback question as well, which is that we know that one of the problems in mental health has been the inability of funding to actually reach the front line of mental health. We've been increasing mental health investment, but our mental health trust has been saying very clearly that the extra money has not been reaching them on the front line. And at the moment, nobody's talking about money because effectively what the government is saying, look, whatever the NHS needs, we will ensure gets funded. But when you're talking about the kind of expansion of mental health service that I think we're going to need here over probably a medium term, one of the really important questions that our trusts are beginning to ask is, okay, we're going to need to fund this beyond the end of COVID. Actually, how is the funding for that going to work? And I think, Dean, you're right to also identify that one of the things that would be helpful as well is ensuring that given the much wider prevalence here about what are the mechanisms we're going to ensure that we identify mental health need. Because again, there were some questions, particularly in terms of children and adolescent mental health services, which Barbara was talking about, that we perhaps weren't getting that right because of capacity constraints. So I think there are a set of really difficult questions.